He made it very clear to every mom out there that his children were immunized about childhood vaccines.
Yeah.
And what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again. And this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed to prevent against infection. And if you look at the vaccine hesitancy rates, they've doubled since COVID. So we have to start addressing these things. We can't just
And
ignore
Deborah,
them.
let me ask you, Deborah. I mean, given that you were the face of COVID from the Trump presidency at the time, do you share this doctor who I was with? Do you share the concerns about the longer term negative impact of some of the COVID vaccines?
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for. But when we say that we're following the science and the data, we need to follow the science and the data. And the science and the data said people primarily over 65 or people with significant comorbidities were at risk for severe disease. Those are the individuals that should have been immunized first. And we should have put our science behind our immunization schedule and protected those most at risk. It went into young people in hospitals before it went into our elderly in nursing homes. That is not following the science and the data. So I am all for following the science and the data, but it shouldn't just be a statement. It should be a reality. And when we don't match what we do in public health to the science and the data, that is when we get into trouble. And that's when we start to fracture trust with the American people.